Now, let's take you live to Pretoria's Zuid-Afrikaans Hospital, where the Health Minister, Dr. Joe Phaahla, has just received a Johnson & Johnson COVID-19 booster shot. Minister Phaahla, good afternoon. I understand you have received that jab now just before we begin our interview. And what went through your mind when you were getting the booster jab?
Well, I must admit, Braden, that maybe it's because I have not practiced for quite some time, and it's quite a while since my first shot. I did get a bit anxious, even though I knew that it would be fine. But it's never, even when you have all the experience, you still get a little bit anxious. But at the end, it went very smooth, no problems at all.
Okay, no, well done for that, leading by example, I must say. But just talk about some of the current issues very, very quickly, Minister. There's a news coming out of the Discovery Health briefing a little bit earlier. It's telling us that vaccine effectiveness of the double Pfizer shot has gone down from 80% in the Delta variant to only about 33% against the Omicron infection, and also down from 93% in Delta to 70% in Omicron against severe complications. Now, it looks like it's a mixed bag here, Minister. What would you say to those who got a bit shaken by this finding? How should we interpret it?
Well, that's the beauty of science. That's why we have the scientists. We are very happy and very blessed to have our scientists who can do all that research. What we need to keep in mind is the fact that for every new medicine, vaccine, any injectable, all these have to be subjected to laboratory tests. But at the end, it just gives us a picture. But at the end, we also see how, as long as it's safe and have some efficiency, we see also when it works in the human body. The comforting fact, Braden, and the listeners and viewers, is the fact that notwithstanding what may be a bit of a worrying information, but we know that the body works more than just in terms of what the laboratory can test. We can see that in the real life, these vaccines are still very effective, even with this Omicron variant, that very few people who have been vaccinated, even as they get infected, get seriously ill. So we welcome the studies, but we must take them in context that the laboratory results do not show everything what the human body is able to respond when it gets assisted with the vaccines.
Yeah, I guess there's a lot to be studied, as we are told. There's a lot that is still relatively unknown. But could these revelations, for instance, be something that government would probably use to speed up the approval of the booster shots for everyone, the likes of us who had the Pfizer vaccine with immediate effect, instead of waiting for that 6 months?
I lost you for a while. If you can repeat the question.
I was saying, could this information that's coming out from the Discovery Health survey assist the government, probably, or government use it to speed up, bring forward the approval of the booster shots for everyone who's had the Pfizer shot, instead of waiting for 6 months, bring it forward with immediate effect?
Well, I don't think necessarily that information says that people are not protected with the double shot. I mean, we will study it further, but my understanding is that, of course, it raises questions on the antibody studies. But what you are saying is that in terms of the total cellular immunity, that has not been proven to have been lower even with this new variant. So we will look at the information, we'll get it through to our advisors, scientific advisors who look at that. We will be amenable. We are not hard and fast. What has been approved by the regulator now was in terms of available information. So that information will be looked at further. But what we must not create panic over is to suggest that, therefore, it means people who have received the 2 doses of Pfizer are not protected. over and above the antibody protection, they still also have cellular immunity, which is showing to be very resilient. So the last thing we want is to create an impression that that study says those who receive the 2 Pfizer doses are openly vulnerable. That's not the result of that study.
Okay, but I mean, there is, of course, Dr. Phaahla, some positive news from what we can gather coming out of this study by Discovery Health. For example, that there's 29% average lower admission risk. So things are working in favor of those who are vaccinated in terms of preventing severe illnesses and admission to hospitals.
Well, that's the fact which I'm emphasizing, that while there are those worrying laboratory results, they don't tell the whole story. The whole story, when you get a complete story, you look at the resilience of the very people who got the 2 doses of Pfizer, including those who got the Johnson, that they are still very well protected against severe illness, which is the reason why few of them have severe illness with the very new variant which is dominant currently. So it tells you that in real life, in the human body, there is a lot more which these vaccines are assisting our bodies to create more protection.
Okay, now, Minister, for a week or so after Omicron was detected here in the country, we saw an increased number of people getting vaccinated, but that momentum seems to have been lost.
Well, that's true. Very disappointing. I mean, the last few days, we've also been hovering just over 100,000. I think yesterday we even were below, just below 100,000, which is very disappointing. You know, one doesn't know whether, because of the fact that fewer people are seriously ill, do people then feel that the COVID is no more a risk? But we want to just really say to people that that will be a mistake. If people think that because we are all confirming the fact that while there was a big scare that this may be very severe, it's not proven to that far in these early days. But that should not let people be complacent. The threat is still very high, and the vaccines are very protective. So we really appreciate the opportunity like you are giving me today to really talk to South Africans, to say, especially our younger people who are the large majority, the 18 to 35 who have come forward in much lower numbers. We urge them that as they will now be going into the festive with a lot of festivities, it is not safe if you are not vaccinated. So please get the message and please take the opportunity.
Yeah. Now, let's just, with the Omicron variant, there have been questions that have been coming up. I wonder if you could shed some light on this, Dr. Phaahla. When are we likely to see South Africa giving detailed report of the variant that has caused death in our daily reporting? Because we've had Delta, now we are dealing with Omicron. I saw some report coming out of the UK yesterday with Boris Johnson and the Prime Minister saying that there are a couple of deaths that they can attribute to Omicron, the Omicron variant. Can we do that in South Africa?
Well, we don't. Our sequencing does not do every confirmed case, but we will be able to get that information because currently Omicron is the dominant. So we will be able, as our pathologists and scientists report also on the deaths, they will be able to, as it becomes the more dominant variant, they will be able to tell us to some extent, as it becomes more dominant, how many of the deaths can be attributed to the Omicron. It should be possible in the next few days.
Okay. Now, Minister, what about this confusion that we saw that was caused by the reporting of new cases on Sunday when your department figures were different from the NICD ones? We heard about late reporting by the National Health Laboratory Service as one of the reasons that the NICD gave for that confusion. But a backlog of 19,840 cases doesn't sound good.
Well, that's something which we are following up with the NICD and the National Health Laboratory Service. because they have to reconcile the numbers from different laboratories every day. They've been doing well. Now, there was just a hiccup over the last few days where they said that there was some problem with the IT system, and that's why there were some confused numbers where they said there was just a bit of a problem with the reconciliation of the numbers. But we are following up with them just to make sure that we can be confident with the data which they are giving us. I accept the fact that it is worrying when a body like that, which we rely on for understanding where we are on a daily basis, then mix up numbers. So they've assured us that the matter is being corrected. But from the department, all that we do, we rely on the numbers which they give us on a daily basis. But I can confirm to the viewers and the listeners that we are following up to make sure that the IT hiccup which happened should be corrected for good.
Yeah, because it also helps with the proper messaging and what people can trust that's coming out from your communication efforts. Now, talking about communication, you've mentioned this earlier on. We are heading to the festive season. I mean, a couple of people already taking leave as of this week as we head towards the 16th of December. We know South Africans love to take this time out of the festive season. What would you like to say to South Africans about their behavior come this festive season that may influence Omicron's impact?
Well, I would like to say that to all South Africans that please don't base your behavior on whatever pronouncement we make from government in terms of saying the numbers, this and that. You now know that this virus, whatever the variant, spreads, especially when it is transmitting very highly like we're having now. It spreads when we congregate, especially indoor congregation, when we are close together, and especially, you know, when it gets nice and we start dancing close together in an enclosed environment, in big numbers, over a long period. It's just a recipe for getting more and more people infected. So we would like to say that we can do it. There is a possibility that we can have a good festive season, a safe one, if we all just take care of the basics which we know. And key amongst those is avoiding crowding, especially indoors, even outdoors, big numbers, close together over long periods. It's very dangerous. So let's take the precautions, and we can see through the Christmas and come back in January with more lives saved and also more livelihoods, people still being able to go around earning a living. So it is possible, but we just all have to take responsibility.
Minister, I heard your interview last Sunday with my colleague Heidi Jokos when she asked about possible further lockdown restrictions. You said things are promising. You used those words, kind of. I'm paraphrasing now in that interview on Sunday here on eNCA with Heidi Jokos. Now, knowing what you know today, seeing what you are seeing, the National Command Coronavirus Council is meeting today, I understand, under the chairmanship of the acting president, the Deputy President David Mabuza. What is your advice to them? Are we going to see harsher restrictions or not?
Well, that's only a few hours away. The meeting was going to take place in just a few hours. When I leave from here, I'm brushing up my report to the meeting. So until the time that we present the report, unfortunately, it's not a long way to wait. I cannot go into details except to say that, as usual, we listen to the signs of what is happening, the high numbers, the fact that our health facilities are still managing. Those are the things which will guide us. The fact that we must balance between saving lives, making sure that the people are safe and they don't get into risky behavior, but at the same time that the economy can still carry on, people can earn a living. Those are the guidelines. That's what the parameters along which I will be presenting a report to the NCCC in about 3 hours now.
Okay,
so
well,
the report of that will after the meeting, we leave that to the acting president.
Okay, we'll have to wait and see. I had to try my luck there, Minister. Finally, before you go, have you got anything to say? Do you know about what's going on in the Eastern Cape? We hear reports of the Gift of the Givers, the NGO, that's been assisting more than 40 Eastern Cape hospitals with food.
Well, my information is that that's really a collaboration between Gift of the Givers and the Eastern Cape Health. But the message which says this collaboration is because the department doesn't have money to buy food, I can tell you now that that is not correct. Gift of the Givers work with us in many ways. Many times I've met with IMTIA's Dr. Suleiman a number of times. He's even come to my office to discuss on possible areas of cooperation. So we really welcome any way in which they can add to some of the services we are providing. But the narrative which says that that is because the province has run out of money or is not able to provide food, as far as my information goes, it's not correct. It's purely a humanitarian additional contribution to what the province and the health department is capable to provide. So that's my information.
Okay, Minister, we're going to have to let you go. Thank you very much for your time just after you got your J&J booster shot there in Pretoria, and good luck with that report that you're going to be handing in. As you said, you now have to brush it up a little bit, hand it in to the National Coronavirus Command Council. We're going to have to wait a few hours before we can find out exactly what will come out of today's National Coronavirus Command Council meeting.